see why in a second. Things I don't like about this position, he's too high for me. Okay, he's a tall guy, he probably needs to bend a lot lower. The other thing is I like to have the feet secured down. So one thing, if I'm dealing with someone who's very short in stature and I need to raise the table up to bring them up to my height, then I need to bring some sort of a step stool or something for under the feet. So that would be ideal, but we'll just go with that right now. Right. So last time when we did the cervical spine, we showed you guys about cradling the head. The idea is trying to take control of the person to make this a more passive assessment, and that's what we're going to do here. And so what I'm going to ask you to do is cross one arm here and then the other arm here. So I'm going to ask him to cross his arms like this, okay? Now, how do I engage with him to get control of his thoracic spine? We're going to test flexion, we're going to test extension, we're going to test side bending, and we're also going to test rotation, all right? I'm going to slide my hand underneath his arm and place it over his shoulder, okay? So his arm's against his body, and then I'm in between here, okay? The other thing is I'm going to get nice and close, and my other hand is going to be over the thoracic spine because I want to feel the movement a little bit. I also want him to get a sense of I have control of that area, that region. And so what the movement becomes is we're going to just move your back through certain motions. I just want you to kind of let me guide the movement. You can follow. And so what's going to happen is I'm going to slouch him down and just give him a good flexion moment through that back. I'll ask him if he gets any pain, reproduction of his symptoms, and then bring him back up. And we're going to do the same thing, extending your back, okay? So we're going to bring him up and backwards. Painful? No?
I don't know.
Maybe. Okay. This is where it becomes difficult for me because he's too tall. Is in side bending, okay? I can side bend him and rotate him in both of these directions. For side bending, I'm going to grab just inferior to the rib cage because I'm trying to focus the force in the thoracic spine, just inferior to his rib cage, and I'm going to pull him in towards me and then side bend him at the same time. So I'm testing side bending left and just getting an assessment for how much motion does he get and how much does that reproduce his symptoms, okay? Now I'm not going to just side bend him over because I got to go over the top of him. And it kind of takes away that passive component. As soon as I start to tip him over this way, all of his muscles on this side are going to catch in because he doesn't want to collapse him over. But if I can pull his lower segment into me, now I feel like I get more of a passive movement there. The last piece is the rotational piece, and so I just ask the person to just rotate, and then I'll try to induce some rotation through the thoracic spine that way. Now to do the opposite, side bend and rotation, what I do is I go to the opposite side. I'm going to ask him to switch his hands, because I want my hand to be under his, and I'll just finish with the opposite two motions. Side bending towards me. So now this is side bending right. I'm going to pull him to me and try to induce that side bending. And then the last one's rotation right for him. Okay? All right. Then from right in there, because I'm already in this position, I just stay here and I go into the resistive testing. To do resistive testing, we just put him in a neutral position, so sit up nice and straight. Good. I'm going to try to push you down towards the floor. Hold, don't let me move you. So I'm going to assess extension first by inducing a flexion moment. So I'm trying to pull him down, and he's fighting me at the same time. It's a slow ramp up, and then I come off. Now we're going to do the same thing, the opposite. So I'm going to test his flexion. I'm going to try to extend him backwards, but he's got to hold and not let me move him. So hold, don't let me move you. See a lot of legs come up off the floor when we start doing this. Good. Same thing. Don't let me push you sideways. Now I'm going to try to side bend him right. So I'm testing side bending left because he's counteracting that. He's going to push into me. So hold, don't let me move you. And I'm going to feel him come into me. And so where I'm really getting the most contractions on his left side. You felt that there? Good. Okay. So same thing with rotation. I'm going to rotate him to the right. But it's his left rotators that are going to fight that movement. So hold, don't let me move you. And so now he's performing a rotation left. Good. And then what I like to do myself, is I come back to the other side one last time just to finish up the other two motions. I'm going to try to bend you sideways. Hold, don't let me move you. So now I'm testing his side bending right muscles. Okay. And then don't let me rotate you. And now he's rotating to his right. I'm trying to push him left. He's rotating right. Okay? Those are the